positions. Due to the financial constraint, many of the states are not implementing the recommended nurse-patient ratio, which is one of the bottleneck for the in the healthcare delivery system, which we are facing either in the district hospital or in the tertiary hospitals. One of the important for anything, we as a big health workforce in the healthcare delivery system, we don't know how many nurses are there in India. I think we always, when the parliament question comes, we say about 18 lakh nurses are there. This 18 lakh nurses, we say that number of nurses qualified from 1947 to date. So we don't know how many nurses have died. We don't know how many nurses have gone abroad. So how many nurses are sitting at home. So we have a live register is one of the concepts which now we have developed. We are going to capture the data of all the nurses working in India, either in the government or in the private sector. Within a 10 months, each nurse will be given a one smart card, and with all the biodata will be available in that. And so that once in 5 years, they have renewed the license with linked with the 150 hours of the continuing education. This whole concept has been started now. Already some of the people have, I think, for the last 1 month, the capturing the data has been started. Within 10 months, we are going to have the live register, and then subsequently, it's going to be an online registration. So the nursing research is one of the, in India, is very infancy stage. Therefore, the Indian Nursing Council has taken the decision of training the scholars in the nursing research. We have taken the Thailand model of the PhD consortium. The author of this Thailand model happens to be a nurse, and she was a member of parliament. She's a nurse, member of parliament. She was the president of the Thailand Nursing Council. So the concept was taken from the Thailand. Now we are training the nursing scholars so that we would like to give more focus for the nursing research. And the another latest the development which has taken place in the Indian Nursing Council is, we have ultimately, with lot of struggle with the Ministry of Health, we were able to get the sanction of the nurse practitioner in critical care, which is a postgraduate 2-year program, MSc level, and all the BSc nurses can get the admission to this program. It is this year we are going to start. Already we have received about 150 such applications, and most likely about 60 to 70 institutions are going to start nurse practitioner in critical care program. Similarly, the Ministry of Health has also approved the nurse practitioner in primary health care program, which is going to be a 1-year program after the BSc nursing, and they will get the credit. If they have to undergo a MSc nursing in community health nursing, they will get 1 year the credit for the passing the MSc nursing in community health nursing. To do these 2 courses, I think there is a need to amend our Indian Nursing Council Act. So therefore, the Nurse Practice Act, which has been now the government of India has asked me to work the draft Nursing Practice Act. So what we have taken, this whole committee is represented by the multidisciplinary team, and we are going to amend the Indian Nursing Council Act. At present, Indian Nursing Council Act is having a focus on education. The practice is not there. So we are going to introduce the concept of practice into the existing Indian Nursing Council Act. One of as I said, the simulation is one of the ways to improve the quality of the nursing education. We are going to develop a state-of-the-art simulation technology in India, and we are going to identify. We are already going to sign the MOU with the lateral company, and also the JAPAGO. The JAPAGO, which is one of the organizations working for the CEO of the JAPAGO, is a nurse. So they are giving more focus on the nursing education. We are Indian Nursing Council, JAPAGO, lateral company. We are working with one of the medical college. We are going to have a state-of-the-art simulation technology to show that how 50% of the syllabus of the BSc nursing can be taught through the simulation. So to have a competency-based training, the simulation technology is one of the answers. The globalization, when we're talking, I think our Indian Nursing Council was one of the organizations first to sign with the BRICS countries. The Indian Nursing Council has signed the alliance with the BRICS countries. The MOA has been signed with all the BRICS countries, Brazil, Russia, India, China, South Africa. This is going to facilitate to work with the networking with these the BRICS countries for the integration, and also some of the, one of the China is having one of the good innovative nursing leadership program which is there. So we are going to work with the China Nurses Association, how some of the nurses can be prepared for the, to take the nursing leadership, and also the research with the Chinese Nurses Association and the Indian Nursing Council is going to be the one of the agenda in the forthcoming years. So thank you very much.
Coming to the last part of the session, before hopefully a very short panel discussion now, I invite Dr. Sanjay Zotpe, Vice President, Public Health Education, PHFI, New Delhi. He is a physician with many international credentials as a public health specialist and epidemiologist. Let's listen to his views on cross-sectional linkages for healthcare delivery. Dr. Sanjay Zotpe, please.
And back, how do you go back?
The presentation, please. Can we have his presentation, please? Oh, sorry, it's
Thank you, luminaries from the field of healthcare, distinguished guests and students. It is indeed my pleasure to be around here and talk to you about need and necessity of cross-sectoral linkages in healthcare sector. Thanks Rajiv, Abhay and Dr. Pandit for this opportunity. And what I would do is that I would try to bring the public health perspective to the current dialogue. There's a national and global commitment towards achieving sustainable development goals. And you can see these 17 goals, and one of them is good health and well-being. That's goal number 3. Why I'm presenting this slide to you is all remaining goals are related to the healthcare. It's not only that we would be focusing on goal number 3 to achieve the healthcare and have the better outcomes for the health, but taking any random example for that matter, clean water and sanitation, is it not going to influence the health? The another example could be like, for example, climate action. Is it not going to impact the health of the people? The another example of reduced inequalities, is it not going to impact the healthcare? It talks about the cross-sectoral linkages. If you wanted to really actually engage in improving the health of the people, you have to talk about all these goals. That's important and critical. Where does India stand today from the perspective of the health? We need to respond to the aspirations of around close to 1.3 billion people in this country. And I'm presenting some of the statistics in the context of trying to see that how cross-sectoral linkages are critical and important. If you look at the infant mortality rate in India is 38, and what's happening in Thailand is 12, Sri Lanka 13, Nepal, Bangladesh, Botswana, they are performing better than us. And same is the story for immunization also. A girl child born in Chhattisgarh or Madhya Pradesh is 5 times more likely to die in the first year of life than a girl child born in Kerala. It talks about inequalities. And therefore we say that in the lottery of life in India, it matters where you are born. If the issue of inequalities would not be responded by the field of medicine, it needs to be really responded much more broader platform. The burden of infectious diseases, 40% of the Indian children are undernourished, and Ghana 14%, and Thailand 7%, and Brazil 2%. It talks about, and malnutrition again would require a very multi-sectoral approach to deal with. It's not only the field of medicine can address the challenges in this field. Rapidly rising burden of non-communicable diseases. Smoking-related deaths presently over 1 million for that matter. The average age of the first heart attack in India is 50 years as compared to 10 years less than what's happening in West. Take an example of air pollution. It's 1.6 million premature deaths are happening in the country, 49 million disability-adjusted life years, and 9% of the total national disease burden has been attributable to both indoor and outdoor air pollution. Suppose you wanted to deal with the air pollution, can the field of medicine deal with the air pollution? People would suffer and then come to the doctors. What we need much more the public health, preventive, and much more cross-sectoral, multi-sectoral strategies to deal with the air pollution. So if you wanted to really keep people healthy, we have to have cross-sectoral approaches being present. Relative per capita disease burden in India is 1 as compared to Brazil, China, and Sri Lanka, again indicating that it's a matter of concern for the country. So the message number of 1 is India's health problems is a matter of concern. Let's move on to understanding what influences the health of the people and health system as the delivery of the vehicle for that matter. What influences the health of the people? The income and poverty and education and water and sanitation, rising levels of risk factors, social services, climate change, food, transport. These are all factors to influence the health of the people. And if we really wanted to deal with these problems, because these are influences of the health, in that context, cross-sectoral approaches, multi-layered approaches would be the necessity. And you cannot just talk about the field of medicine and providing and dealing with the diagnosing patients and dealing. That's necessity, but that's not sufficient. Therefore, and then this is also endorsed by the WHO Commission on Social Determinants of the Health, that beyond health measures are extremely critical in improving the health of the people. Because we all understand that health is also affected by the several determinants which lie outside the conventional health sector. And therefore, we say that what we require is multidisciplinary, multi-sectoral, and multi-layered approaches to improve the health of the people. I will give a couple of examples that how it is important to understand the policies in other sectors are also important and how they influence the health of the people. We have an example for that matter, like smoke-free laws and increased taxation of tobacco products have been identified as very effective strategies for reducing heart attacks and strokes. And that the World Health Organization and World Bank and several other researchers globally have actually endorsed this, that if you deal with these smoke-free laws and increased taxation of tobacco products, we can really improve, reduce the burden because of the cardiovascular mortality. In that context, here is an example. If we implement the smoke-free laws and tax every tobacco product appropriately, we would avoid 25% of the heart attacks and strokes during a period of around 10 years. Such an influence. And if you compare that influence with, it will have much more impact than all the drugs that the cardiologist of this country would prescribe. So see the impact of that. And if we really wanted to engage, we will have to engage with the Ministry of Law and the Ministry of Finance. We'll have to go and talk to the finance minister of the country regarding the taxation policies in the context of the tobacco products, where we require, again, the cross-sectoral approaches. Another example, if we impose 20% of the tax on sugar-sweetened beverages, we will be able to prevent around 11.2 million cases of overweight and obesity and 400,000 cases of diabetes over the next 10 years. Again, the issue of taxation, we'll have to engage with the Ministry of Finance to ensure that it would have influence on the diabetes. Air pollution is another example for that matter. It is ranked as leading cause of death and disability in the global burden of disease tells us, and I mentioned about this figure, it's 9% of the total national disease burden. If we really look at the controlling the air pollution, I come from Delhi, which is the most polluted city in the world. It competes with the Beijing, that whether Beijing is more polluted or Delhi is much more polluted. And what would require to deal with that is the policies beyond health sector. The air pollution as a problem, which impacts and influences the health of the people. So the message number 2 is assuring health requires approaches beyond health sector. Let's talk about the reflection on India's health systems for that matter. If we have a mixed system, and we talked about it, 20% of our rural population does not have access to the health services. And if we currently talk about the public financing of the health, it is lowest in the world. It is somewhere ranging between 1 to 1.2% of the GDP. And if you look at as comparison to the Sri Lanka, it is half of the Sri Lanka. It is fourth of what China is spending. I'm talking about the public spending. At sixth of Thailand. If you really wanted to ensure that the public spending on health is improves in India, we'll really have to engage with the finance ministry to see that it improves. 70% of our health expenditure is out of pocket. At the bottom, we are at the bottom actually if you look at the public spending is concerned, and top in terms of the out-of-pocket expenditure is concerned. We rank number 172 out of 190 countries, and that mostly is attributed to the outpatient care and expenditure on medicines. So we'll have to engage with the Ministry of, the Department of Pharmaceuticals, which deals with the, and now the Prime Minister's commitments to a generic medicine will be partly address this particular issue. Similarly, there are issues in the context of the critical shortage of the health professionals, and Dr. Dilip Kumar also mentioned about the nursing professionals, but we have weak health information systems and governance and leadership as a part of the health systems. We'll have to deal with cross-sectional link to this. So the message number 3 is India's health systems needs to be strengthened. Let's move on to three important messages that I have presented here. India's health problems is a matter of concern. Assuring health requires approaches beyond health sector, and India's health system needs to be strengthened. For that, what we will have to do is that assure health. So health assurance will help us to respond to these challenges. And for me, what health assurance is, it's very simple. Health assurance has two words, health and assurance. It is the assurance about the health to the people of this country. And what kind of health? The health they desire, the health they dream, the health they deserve, and the health they demand. So in democratic setup, where people demand health, in that context, we'll have to respond to the health assurance. We'll need cross-sectoral linkages. So what is health assurance? Just mention about two important things. Universal health coverage is an instrument in advancing the agenda of health assurance. Two quotes talking about the relevance and importance of universal health coverage. What does it tell us? It tells us about a state where all people would receive the quality health services where they are not suffering from the financial hardships. So it has three important components. One is all of the people, second is quality health services, and financial protection. So that is what is the universal health coverage is all about. But universal health coverage is not only sufficient to take care of the health of the people. It is necessity, but it is necessary, but it is not sufficient, because it also requires, in addition to that, addressing the social determinants of the health. If you address the social determinants of health, also provide the universal health care to the people of the country, then probably you are talking about the health assurance and towards improving the agenda of providing and taking care of the health of the people. And therefore, you really wanted to shape the slogan for that. The health assurance will provide an opportunity to respond to the aspirations of the 1.3 billion people of this country. So the message number 4 is we have to advance the agenda of health assurance for moving towards sustainable development goals, which needs clear-cut emphasis on cross-sectoral linkages. Otherwise, we'll not be able to advance this particular agenda and achieve the sustainable development goals, which is a national commitment. And that would help us basically creating Swasth Bharat along with Swachh Bharat. Thank you. Thank you so much.
Thank you, Dr. Sanjay, for such an empowering talk. Now we have maybe 2 or maybe 3 questions in the panel discussion. So could I, maybe one question from this side, one from this side, and one from the center. So if there's any question, please come up. We have a panel of so many specialists today in front of us. Any questions, please? No questions? Yes, sir. Mike.
I have a question to Dr. Hegde. Sir, you made a statement that nobody has seen electron. As a student of science, then I would like to know, how do we give the atomic weight of an element? How do we give the proton numbers in an element? And how do we give the electron numbers? I'm not meaning, but I have a doubt. The second question of mine is to the lecturer who spoke on simulation technology as a teaching tool. Should it be a substitute to present technology, or should it be a supplement to the present technology? That's my question, because if you take it as a substitute, it will be disastrous. If you take it as a supplement, yes, it is going to be a very, very good tool. Thank you, sir.
Dr. Hegde.
I think the first question is very easy to answer. I wish you had followed science. You said you are a scientist, right? Did you say you're a scientist?
Doctor, sir. I am a doctor.
Okay.
I belong to same profession as you do.
Okay. Now
And,
I'll tell you something.
The atom has been analyzed for
Hang-
the
hang-
proton, electrons,
Let me
and
just
neutrons.
let me finish. Number 1, you and I are taught in school that inside an atom you have a nucleus, electrons running in circles, jumping up and down. But the truth is there is nothing inside an atom. It is empty.
Then how do we calculate the atomic weight?
That's a good question. That's what I said. What is science is all a golem. You know what
So-
golem is? You don't know.
No,
Golem is a
I
scale.
don't want to antagonize you. This is just an academic doubt.
I am trying to tell you that science has completely changed and atom doesn't have anything inside.
Sir, with humility, I accept your statement. Thank you.
No. See, all this, I didn't want to tell you that all these atomic numbers, etc., are all cooked up for whatever reasons they are. I'm not going to the reasons because, if you went into the reasons, then it will be very difficult. please try to understand that science, as you know, as we know, of the conventional, what is called solid state physics about atoms and their size and their weight, etc., has all been proved wrong. This is science. Science is change. The very definition of science is change. If science doesn't change, it's not called science. There was a big case in the federal court in USA 4 years ago between scientists and creationists. And the judge gave a beautiful statement. He said, creationists cannot be scientific for the simple reason they have not changed. Ever since Jesus' time, it has been the same. But science is good because science changes. And he said definition of science is change. And definition of life itself is change. If you understand, if you go to the Oxford Dictionary and see what life is, ceaseless change till death. So science has changed and all these numbers have also changed. Thank you.
Thank you, Dr. Hegde.
I think the simulation technology is only a substitute which we are planning, because the competency-based training has to be given because the skills has to be acquired competence. So therefore, the simulation technology is the answer for the competency-based training program. So therefore, it is a supplement. It is not a fully.
Thank you.
Myself,
Yes, please.
myself, Dr. Abhishek. My question is not particular to anybody can answer. My question is like when we go to this integrated medicine, the main problem that we are facing now is where we draw the line. Like for example, a homeopathy is using steroids and we are using theirs, and how do we solve this problem?
No.
Yeah.
I think
Yeah,
it's
I
a,
think we
I
can't
think
make
it's a very pertinent question. I'll answer that. Modern medical people think that Ayurveda uses steroids and homeopathy uses steroids. But what we don't realize is we use steroids day in and day out for reasons we don't know. Autoimmune disease, what are you giving? Steroids. And you know, steroids are so bad that the recent study shows that even if a short course of steroids is doing so much of health damage. So we just, we don't know. And the second thing is the most important part of integrated medicine is none of these things. It's the ego. Now, in a hospital, they said in Safdarjung, we have the Department of Ayurveda. No use. The mainline medicine man will never recognize that. Now, what we should do is, we have a model we are trying to come up all over the world, is all these so-called specialists sit together in one table in the outpatient department, each one without his or her ego. And when a patient comes, you try to find out collectively with your brains together as to which system is the best, because large studies have shown that when a doctor sees in society one heart attack, he will have seen 36,000 minor illness syndromes. Which means today, even for minor illness syndromes, we use modern medicine, antibiotics and things like that, because as Sudarshan rightly said, antibiotics cures everything. It has cured now also leprosy. Leprosy is cured because of the better nourishment. And it's the immune system that has come up that has cured leprosy. Now, tuberculosis is not cured with tubercular drugs because now multi-drug resistant tuberculosis is too much. So modern medicine presumes a lot of things. And we should not presume that. What we should do is shed our ego, sit together, and think that Ayurvedic man is also as good as you. And the homeopath also is as good as you. And there's an effort to kill homeopathy all over the world, done by the modern medical establishment. Unfortunately or fortunately, because of the Queen in London who follows homeopathy, homeopathy is not dead in England. And that's the only country, because America, they're killing homeopathy left, right, and center, saying that homeopathy is bullshit. But actually, homeopathy is very powerful medicine, but it has limits. The fortune and misfortune is this. Ayurveda man says, I'll cure cancer. Homeopathy says, I'll cure everything. That's where we don't know, we are ignorant. We can't cure nothing. All that we do is we can heal most of the patients with a collective effort. And this model is running very well. And all the specialists sit together to look after the patient. And this is where and the model that Sudarshan showed about village, he has done phenomenal work. What he has done in Karnataka, in the Adivasi areas for the last 20, 30 years is something phenomenal. But that again can be done with the same attitude towards integration, rather than saying that modern medicine does everything. Mouth-to-mouth breathing was not invented by modern medicine. Mouth-to-mouth was invented by a nurse. Actually, it was invented. See, one nurse, one woman who was not even a trained nurse, Her name was Florence. She was sent to Crimean War what's the place called? Scutari. And she was sent there, and mortality of patients in the war, the so-called British hospital was 100%. Whoever went to that hospital never came back. This girl went there and did something remarkable. In 3 months, she brought it down to 60%, then to 40%. She said, I have done it with 3 things. A, bread, brush, and cleaning, and dressing. And she was called herself a general of brushes, buckets, and food. And this is where the mortality comes down, not because of modern medicine or Ayurveda or homeopathy or Rumapathy. Whatever be the pati, as long as the doctor has sympathy and empathy, the patient will get better. Because the two most powerful drugs invented by mankind, said William Osler, are the 2 kind words of a good doctor. There's a study done in Thailand of all the systems there prevailing and on society's effect. The modern medicine of the Western type, Chinese medicine pure, Chinese modern medicine integrated, Samoa system where the father tells the son what to do, and Quackery. And at the end of 5 years, the WHO study showed that all systems had same effect on public. And this is because very, very important, because you can bring down the cost. Now they're talking about the cost. You will be certain that upper respiratory infections of viral origin produce 50 million sick absenteeism in Europe in one day. 50 million is a large number. And today we use all the 50 million antibiotics. Instead, just one homeopathic drug, arum triphyllatum or Sambucus nigra, can do most of the homeopathic medicines. So we have to understand the whole. We each one looking at a reductionist idea, my side. That's not the way. You have to leave off your ego and then say, okay, homeopathy may have something good. You will be surprised. If I get an upper respiratory infection, I don't take my medicine, I take homeopathic medicine. I fell under an auto rickshaw when I was going for a walk. Auto rickshaw man dashed me and then went on me. I didn't go to modern medical hospital. I am all right. Now there are methods you can do. A lot of things are there. But the problem today is not that. Folk medicine in India is so powerful. We don't investigate that. And folk medicine all over the world is important. Now what we have to do is, government has to have a holistic view, and government must be advised by somebody who understands what is a holistic view. Because each one advising the government what he wants. And that's where the problem comes. And the government cannot be Mr. Know-all. After all, they are politicians. But they have to be educated. And unfortunately, that's not happening today. And this is where the future depends on all systems trying to help our human beings. That's the most important thing.
Very nice. Thank you, sir. I think this was the cream talk of the session, which brings us to the close, well on time. And I'll quickly just thank all of you for being such a wonderful audience. And thanks to Symbiosis for planning such a wonderful session. And thanks to all the speakers here for being so cooperative. I was feeling so bad telling you to please monitor your talk, but we all have done great justice to the whole panel and the contents. Thank you very much. Thank you, everyone. Thank you.
I would request you all to please stay back for 5 minutes. Thank you, speakers, for widening our understanding on the various topics covered today. May I now request Dr. Rajiv Yaravdekar, Dean, Faculty of Health and Biomedical Sciences, to felicitate our speakers. Dr. B.M. Hegde, former Vice Chancellor, Manipal University. Dr. N. Shrikant, Deputy Director General, Central Council for Research in Ayurvedic Sciences, Ministry of Ayush, Government of India. Dr. R. Nagaratna, Medical Director, Arogya Dharma, Vyasa. Dr. K. S. Sethi, Deputy Advisor, Homeopathy, Government of India. Dr. Surgeon Captain Kushilap Bose, Chief Medical Operations, Health Spring. Dr. Sudarshan, Honorary Secretary, Karuna Trust. Dr. Dilip Kumar, President, Indian Nursing Council. Dr. Sanjay Zodpe, Vice President, Public Health Education, Public Health Foundation of India. Thank you, sir. Before we conclude, we have a few announcements. This is regarding the Maharashtra Nursing Council credit point. Nursing delegates are requested to contact the Maharashtra Nursing Council registration counter at Central Library for any queries regarding the credit points. At Symbiosis, we care about your opinions and what you think of us. So, we have the digital feedback form link available on the SYMHEALTH 2017 website as well as on the app. If you have any problem to view the feedback form, you are requested to update the app to its latest update. You are all now requested to please proceed for lunch and join us for valedictory at 2:55 in the auditorium. Thank you. We would like to thank you, ma'am, for your valuable inputs